Assalamu alaikum. My dear students, I am Dr. Sagia Afroz, Associate Professor, Department of Pharmacology, Bashundhara Ad-din Medical College. Today I am going to discuss about anti-diabetic drug. Before going to drug, we have to know about the disease in short. What is diabetes? Diabetes is a metabolic disorder that is characterized by elevated blood glucose level associated with absolute or relative lack of insulin from the pancreatic beta cell. There are several types of diabetes: type 1 diabetes, type 2 diabetes, gestational diabetes and diabetes due to other cause. At first, I am going to tell about type 1 diabetes. Type 1 diabetes is also known as juvenile onset diabetes mellitus. The most common cause is production of autoimmune antibody that are detectable in the blood and that leads to destruction of the pancreatic beta cell, resulting in severe or absolute insulin deficiency. In the type 1 diabetes, the circulating insulin levels are low or very low and patients are more prone to develop ketosis. It is the less common type of diabetes, but there is less degree of genetic predisposition and insulin replacement therapy is very necessary to sustain life. In type 2 diabetes mellitus, it is also called maturity onset diabetes mellitus. Insulin in circulation is low, normal or high, but there is no autoantibody is found in the blood and there is high degree of genetic predisposition. The most common cause of type 2 diabetes are reduce the sensitivity of peripheral tissue to insulin, that is insulin resistance, reduce the number of insulin receptors and obesity that may lead to relative insulin deficiency. Now, I am going to tell what is gestational diabetes. Abnormality in the blood glucose level that is noted for the first time during pregnancy. Placenta and placental hormones create an insulin resistance that is more prone to produce in the last trimester of pregnancy. And now the other cause of diabetes, such as some pancreatic disease and some drug therapy. Pancreatic disease like pancreatitis, pancreatectomy, in which the pancreatic beta cell is unable to produce insulin, and drug therapy like corticosteroid therapy, growth hormone therapy, oral contraceptive pill, thyroid hormone, glucagon and thiazide diuretics, etc. Now, what are the drugs or what are the anti-diabetic drugs that we use in diabetes? There are two types of anti-diabetic drugs according to their route. Number one is parenteral anti-diabetic drug, that is insulin, and there are several preparations of insulin. Number one, the rapid acting insulin, insulin lispro, insulin aspart, insulin glulicin, and the short acting insulin, insoluble insulin and regular insulin. Number 3, intermediate insulin, that is lenti-insulin or isophane insulin, and long acting insulin, that is insulin glargine and insulin detemir. And insulin is also classified according to their source like bovine insulin, porcine insulin and human insulin. Bovine insulin differs from human insulin by only 3 amino acid and it is more antigenic, and porcine insulin that differs from human insulin only 1 amino acid and it is less antigenic. The human insulin made by enzymatic modification of the porcine insulin or by using the recombinant DNA technology to synthesize the proinsulin. The other type of antidiabetic drugs are oral antidiabetic drugs. And oral antidiabetic drugs are categorized into 3 varieties, Number 1 is insulin secretagogue, number 2 is insulin sensitizer, and number 3 is agents that reduce the glucose absorption. Insulin secretagogues. Insulin secretagogues are agents that increase the endogenous insulin release, and insulin sensitizers are that agents that reduce the insulin resistance. What are the insulin secretagogues? The sulfonylureas, meglitinide, incretin analogs and mimetics like GLP-1 receptor agonist and DPP-4 inhibitors. Number 2, insulin sensitizers like biguanides, thiazolidinediones, and the agent that reduce the glucose absorption like alpha glucosidase inhibitors. Now, sulfonylureas. Sulfonylureas are divided into two generations, first generation and second generation. First generation drugs are tolbutamide, chlorpropamide, and second generation drugs are glibenclamide, glipizide, gliclazide and glimepiride. Number 2, biguanides. Biguanides are metformin, fenformin, buformin, etc. Meglitinide derivatives like lipaglinide, natiglinide, etc. Thiazolidinediones like rosiglitazone, pioglitazone, etc. Alpha glucosidase inhibitor like acarbose, meglitol, and dipeptidyl peptidase 4 inhibitor or DPP-4 inhibitor like sitagliptin, saxagliptin, vildagliptin, linagliptin, etc. And the GLP-1 receptor agonist like exenatide and liraglutide. That is all for today. The rest of the class I will take in next session. Thank you all.